think the NHS is undergoing a huge period of transformation, as everyone, I'm sure, is aware. And speaking to clinical staff and going back to clinical practice, people are very much done to and feel like they're done to. So this is an opportunity for people to really get together and think about the changes they want to make, and quite often they're not allowed to make.
At the moment in the NHS, we have a generation of people who have seen how the NHS has worked well, but also seen how it's not worked always for patient benefit, and have had enthusiasm and zest to make things better.
When we look at radical changes, one of the things that we see time and time again is that right at the front of the change is a group of young leaders who are dissatisfied with the status quo and want things to be different. We saw that in 1948 with the establishment of the NHS.
Back then it was about creating something new. For NHS Change Day, that's about sustaining the NHS.
Doctors, nurses, particularly new up and coming ones that are just kind of fresh out of medical school or fresh out of nursing school, they can see so much potential and just feel that it's a bit too long in coming.
The aim of NHS Change Day is a single day of simultaneous improvement and change throughout the NHS and possibly beyond as well.
What we want is anybody who works with, works for, or is connected with the NHS to pledge to take an action on NHS Change Day.
A great analogy is children in need and comic relief. People enjoy raising money for charity, but actually you sometimes need a bit of stimulus to do that, and comic relief and children in need work well because on the same day lots of other people are going to be doing fun things to raise money for charity, and it's that extra incentive to get involved. And Change Day is the same thing.
So I think what we're trying to do is create a real sense of actually this is our NHS, everybody's, we're all in it together.
We want to get 65,000 people across the NHS engaged and supporting it and making pledges. So it's important that you have an idea, that you share the idea, and that you have a way of putting your idea into action. And
the idea being is that if everyone comes to do it together on Change Day, maybe they will remember to do it the day after. And if not, we can have future Change Days just reinforcing some of these core principles. My pledge on Change Day is going to be to try and taste some paediatric medicines. One of the things that doctors prescribe all the time to children is medicines that taste particularly unpalatable, and it'd be great for paediatricians and other clinicians who deal with children to know exactly what they're prescribing.
My pledge for NHS Change Day is to spend a day with a frontline clinical team so that I can connect and reconnect my motivations with what I do with the reality.
Anybody who thinks the NHS is theirs, for them and for their family, can and should be involved.
We've got receptionists in general practice, we've got hospital porters, and we've even got whole organisations that are pledging.
It might be clinical staff, it might be managerial staff, it might be commissioners.
It's for everybody to be involved, from patients to carers, for people outside of the NHS.
The voluntary sector, the charities, social care people who work for local authorities in care homes.
It's important for us all to get involved, because if we want to make large-scale change and show that change is possible in the NHS, it takes our collective individual actions to do that.
Each change at every level in the system is going to make a difference and an impact. Nothing's too small and nothing's too big. My pledge for NHS Change Day is, as a patient, as a member of the public, to get my own GP practice engaged in improving patient care within the practice.
My pledge for NHS Change Day is to attend a centre of excellence for dementia care and to identify the areas of good practice that I can take into other areas that I will be working in the future.
My mum has recently been diagnosed with a brain condition, so my NHS Change Day pledge will be to work with the Brain and Spine Foundation, a charitable foundation from NHS Change Day going forward.
I'm a nurse by background, but I haven't nursed for 12 years. I pledge on NHS Change Day to spend some time back in my local hospital up in Hull, working with patients and staff and getting back to the basics of why I joined the NHS.
This is an opportunity that doesn't come around very often, that we've been given a distinct chance to make a change. We've been given a distinct chance to be part of the single biggest improvement exercise there probably has ever been in the NHS.
The NHS, however much we love to knock it, it's a precious thing and it won't necessarily always be there. And it's not enough to say it should be if you're not prepared to take responsibility for making sure it is.